pioneering approach based on ultra-fast ultrasound imaging of shear waves velocity offers a breakthrough in the non-invasive assessment of myocardial stiffness. Cardiovascular diseases remain the leading cause of death globally, accounting for 17.9 million deaths each year. They affect millions of patients worldwide, including more than 64 million people living with heart failure. Among them, heart failure with preserved ejection fraction represents 40 to 50% of cases. Within this broader landscape, cardiomyopathies play a central role. Cardiomyopathies are diseases that change the structure and the mechanical properties of the heart muscle. Some make the myocardium weak, others make it abnormally thick or stiff, ultimately affecting its ability to relax and pump efficiently. Among these cardiomyopathies, hypertrophic cardiomyopathy and cardiac amyloidosis stand out for their complexity. Cardiac amyloidosis is particularly underdiagnosed. Up to 13% of patients with HFpEF may actually have an undiagnosed cardiac amyloidosis. The therapeutic landscape has evolved rapidly, with new drugs now available to improve both symptoms and prognosis in hypertrophic cardiomyopathy and cardiac amyloidosis. Yet cardiologists still lack the dedicated tool for accurate diagnosis and follow-up in these patients. (2D) echocardiography primarily gives anatomical information: shape, size, structure. It allows assessment of the anatomical structures and functional movements of the heart. Strain or speckle tracking analyzes motion and deformation patterns of the myocardium. It reflects function but not tissue composition. To evaluate intrinsic tissue properties like stiffness or fibrosis, other modalities such as elastography are needed. The quantification of myocardial stiffness is a major challenge for the diagnosis of heart diseases and the assessment of cardiac function. To this day, there are no non-invasive imaging modalities capable of measuring myocardial stiffness in clinical practice. This is exactly what Vasello is designed to deliver: a device that is fast enough for routine clinical use, cost-effective for broad adoption, and easy for clinicians to use in their daily workflow. With Vasello, focused ultrasound waves are directed toward the heart. These waves generate an acoustic radiation force that induces a shear wave propagating through the myocardium. Shear wave propagation is tracked using ultra-fast ultrasound imaging, 10,000 frames per second. Shear wave velocity provides a quantitative measure of tissue stiffness. Increased myocardial stiffness results in a higher shear wave propagation speed. 3D myocardial shear wave elastography can track the waves in all different directions of the myocardial anisotropic tissue and enables accurate quantification of the local myocardial stiffness. Vasello, a novel, powerful 3D shear wave elastography device, combines a new modality and biomarker, tracking shear wave velocity to provide a non-invasive assessment of myocardial stiffness. Vasello by eMyosound directs a precise acoustic radiation force to generate shear waves in specific regions of the myocardium: right ventricular wall, septum, and apex. This targeted approach provides highly localized insights into myocardial stiffness. Vasello by eMyosound allows precise selection of the optimal time frame within the cardiac cycle, focusing on end diastole, when the myocardium is fully relaxed. A new generation of echocardiography is in sight, one capable of precisely characterizing myocardial stiffness in space and time. Vasello by eMyosound was founded to address the clinical gap in cardiomyopathy diagnosis by leveraging the biomarker for myocardial stiffness to change the course of heart failure diagnosis and improve patient outcomes. Vasello by eMyosound, making the invisible now measurable. Transformation is in sight.